If you go back to 10 years ago, patients were getting more radical neck dissections. There was more accessory nerve damage. Radiation wasn't quite as pinpointed. Chemo drugs were a little bit different, so you had a full gamut of different side effects.
Head and neck cancers are fairly treatable, but patients often face devastating effects, like losing part of their jaw or tongue.
After you take the cancer out, you have to be able to put them back together, if you will. And, a big goal of ours is to give our patients a reasonable quality of life.
A specialist in head and neck cancer surgery, Dr. Tony Anfuso, is offering advanced techniques to patients in Southwest Florida, including a technique called free flap reconstruction.
That's where you take either some soft tissue from the arm or the thigh, or you can take bone from the leg and reconstruct a mandible. And you use that tissue to reconstruct their tissues of the head and neck.
Building on better surgical options, today's oral cancer patients face a better future. The newly relocated tissue is altered to look and perform as closely as possible to the original, decreasing disfigurement and boosting quality of life, a far different outlook than in years past.
The chances of this flap surviving is higher today than it's ever been, and we can do it in a shorter amount of time. That allow us to do bigger surgeries and try and tackle bigger cancers.
For Lee Memorial Health System, I'm Amy OSHIER.